Hi, I'm H&HN Daily Moderator George Tefelsky, and today I'm joined by Bill Santamour, Managing Editor of Hospitals and Health Networks magazine, to take an inside look at the September issue of H&HN, which is now available online and in print. Bill, thanks for joining me today.
Thanks, George.
So, Bill, tell me about this month's cover story.
Well, our cover story is about ICD-10 and the changeover that's going to take place in 2 years, October 1st, 2013. And we've done stories about this for a couple of years now, just warning people that it's happening and that they better get started preparing for it. But what we found in our conversations with CEOs and other executives was that they're really not focused on it as much as they really need to be, because they've got day-to-day crises to deal with. They've got a lot of stuff on their plate. And so we decided to do a cover story that would really bring the urgency of the matter to their attention. It's not too late to get started, but they've got to get started right now. There's so many complex issues that they have to deal with. I mean, it's not just about training the coders, it's training the doctors and the nurses and other clinicians, anybody who has anything to do with patient care. It's about educating your board of trustees. It's about making sure the IT is in place, working with your vendors on software to make sure it can handle the new coding system. It's about making sure your revenue cycle is adjusted to deal with the new billing system. So it's a lot of issues that are going to take some amount of time to deal with, and you've only got 2 years. It sounds like a lot of time. It isn't. You better get started now.
So what percentage of hospitals are kind of behind on this?
Well, there are some hospitals, there's a certain number of hospitals that are ahead of the issue that have gotten started. A lot of hospitals have gotten started, but a lot of them haven't. They've just got too much on their agenda already. And it's going to hit different hospitals differently. I mean, if you have a lot of patients, a lot of different type of care that you offer, it's going to be more complex. If you're a small hospital with a small staff, a small number of IT vendors, it's going to be a little bit easier.
So switching gears a bit, there's also an article about physical therapy this month. Can you tell me about it?
It's part of our ongoing clinical management series that we look at a service line or a disease or whatever and look at what challenges the hospital, how that's changed over time for hospitals to deal with. And in September, we talk about physical therapy and how the physical therapists have stepped up in their role. They're taking a much more aggressive and prominent role in the whole medical team. They're coming into caring for acute care patients earlier than they used to. There used to be this feeling that physical therapy couldn't start too early because these patients were too sick, and it would do more harm than good. What they're finding is that it's actually better to start it earlier. And the story looks at how physical therapists are becoming integrated into the whole medical team for a patient.
So that wasn't the case before? Physical therapy was not part of the clinical team?
They came in late in the whole process, or they had a smaller role. Now there's a recognition that physical therapy is much more important and earlier in the process.
So this article kind of talks through the changes in physical therapy's role in relation to the clinical team.
Yeah, and we talk about hospitals where it's happening and how it's happening and why.
And finally, Bill, what's in the extra mile section this month?
A lot of stories about the challenges that hospital leaders face every day, and it can be sometimes overwhelming, all the stuff that they have to deal with. So we try to, when we can, really explain why people get into healthcare in the first place and give people pats on the back when they need it, when they deserve it. This month we talked to a doctor at the Cleveland Clinic, a kidney transplant surgeon called Charles Maudlin Jr. And he is African American, and he decided that he needed to reach out to the African American community, especially men, and get them aware of what they need to do healthcare-wise and get them the services that they need. He started a minority men's health fair. The first year, which was several years ago, he had 30 people. This year he had 2,000 people attend. He's done things like set up free clinic, Minority Men's Free Clinic, I think it's called. And then he's also set up a thing for researchers where he collects data from the African American community that anonymously researchers can access and study.
Well, Bill, thank you for joining me today.
Thank you, George.